Cancer care has been changing and evolving, and in current day practice, we have a lot of new different treatment options, and cancer care has to be tailored to each individual person based on the tumor type and also the stage of the tumor. And different treatment options have different benefits and different side effects, and we want to make sure each patient is getting the best option and best shot at treatment. I was trained in New York, where I did my residency in Brooklyn, and subsequently I did fellowship at Allegheny General Health in Pittsburgh. And since then, I've moved to Baltimore and started working at MedStar Health. Some of the more common cancers I treat at MedStar Health are lung cancer, melanoma, gastrointestinal cancers, which include gastric cancer, esophageal cancer, pancreatic cancer, and also genitourinary cancers, which include prostate cancer, bladder cancer, and testicular cancer. The treatment for cancer has been evolving. A couple decades ago, the treatment for cancer mainly involved the use of chemotherapy, but currently we have the advent of immunotherapy and targeted therapy, which are helpful to treat cancer in a better fashion with better prognosis and minimal side effects. Immunotherapy is a new drug that has been out for almost 10 years now. And what immunotherapy is it is an IV drug that helps ramp up your body's immune system to help fight the cancer harder. So it's essentially your own body's defense cells that are helping fight the cancer harder and stronger to help kill the cancer cells and get rid of the cancer cells. Molecular testing is something that we're using more and more often these days. Molecular testing means that whenever cancer is starting to grow, we know that it is going through different pathways. And the goal of molecular testing is to see and find what these pathways are and use drugs, sometimes in the form of pills, to help target them specifically so that we're able to effectively treat cancer with minimal side effects. Along with the FDA-approved drugs at MedStar Health, we also have access to clinical trials where we're able to use not just immunotherapy and targeted therapy, but also newer drugs that are in the making to see if that'll be beneficial for our patients here. The treatment of cancer has been evolving, and we want to make sure it is multidisciplinary in nature. That means the involvement of different set of doctors to make sure we're giving the patients the best care. It includes surgeons, radiation oncologists, also pathologists and radiologists, and we all sit together as a team to make sure we're discussing what are the risks and benefits of different treatment options that are available and make sure our patients are receiving the best treatments. Cancer care should be patient-centered, and the goal of treatment is to make sure that the patient is comfortable communicating with me and getting all the information he needs so that he can make an informed decision at the end of the visit. Whenever I see one of my patients with a new diagnosis of cancer, I want to make sure they're able to understand the different treatment options, but not only that, we know that different patients come from different backgrounds and have different goals, so we want to make sure each patient and their goals are addressed and not just treat the illness. I love being a medical oncologist because taking care of these patients on a day-to-day basis makes me feel like I'm adding a lot to their care and also being personalized and developing long-lasting relationship with them.